Good afternoon, everyone, and welcome to today's update on New Brunswick's Return to School Plan. Bonjour tout le monde et bienvenue à cette mise à jour au sujet du plan de retour à l'école du Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le ministre de l'Éducation et Développement de la Petite Enfance, Dominic Cardy, et la médecine hygiéniste en chef, la Dr. Jennifer Russell. Speaking on behalf of the province today are Minister of Education and Early Childhood Development, Dominic Cardy, and Dr. Jennifer Russell, the province's Chief Medical Officer. Minister Cardy?
Thank you, Danielle. Thank you very much, Dr. Russell, again for being here today. So this is the end of the beginning in terms of back to school plans as we get ready for a return to classes in a few weeks' time. So I want to thank you for what's going to be the first of several updates that are going to take place over the next few weeks on our return to school plan that was first shared several months ago. So je vais commencer par remercier Dr. Russell pour être ici avec nous aujourd'hui pour discuter le plan pour le retour à l'école. Ça va être le premier de quelques breuvages qu'on peut avoir sur ce sujet. En juin dernier, j'ai eu le plaisir d'être un des premiers ministres d'éducation au Canada à rendre public un plan pour le retour à l'école. So in June of this year, I was happy to be one of the first education ministers across the country to share a return to school plan. And at the Department of Education and Early Childhood Development, we understood that even though school had just officially ended for the year, that students and parents were already thinking ahead to this September. And we have, of course, all being faced with anxiety and uncertainties as we navigate the COVID-19 pandemic. And that's why we've tried as much as possible over the summer as all this work is going on to provide updates on what we've been doing inside the department, the work at the districts, and down to the school level. But I know and I understand that parents and students still have many, many questions. So throughout the summer, teachers across the province had the opportunity to participate in professional learning opportunities to help them prepare for the school year. We've been working closely with the school district and the schools to make sure that they're ready to implement these new health and safety measures that are the focus of the briefing today. So nous avons collaboré de près avec les districts scolaires et les directions des écoles pour nous assurer qu'ils soient bien préparés à mettre en œuvre des mesures de santé et de sécurité. We've had meetings with the principals of all 294 schools across the province. Wanted to make sure we had those before this briefing to make sure they could share that information with their teaching staff, because we have to show respect for our teachers by making sure they have the information that, of course, they're going to be required to implement and manage in their classrooms. So we met with all of those 294 principals to give them the tools and the knowledge that they require to finalize and implement their COVID-19 operational plans in their schools. Il y a eu plusieurs rencontres, les réunions avec les directions des 94 écoles dans l'ensemble de la province afin de leur fournir les outils et les connaissances dont ils ont besoin pour finaliser et mettre en œuvre leur plan opérationnel dans le contexte de la COVID-19. So as I said, over the course of the coming weeks leading up to, and if necessary after school starts up again, we're going to have these regular bi-weekly press conferences and other sorts of new availabilities to answer questions. And of course, schools at the local level are going to be sharing their individual operational plans. But I will ask that parents continue to be patient. I know that you have got anxieties, but I assure you that we are working and doing our absolute best to ensure the safety of students and of all of our staff. We've been working very closely with Dr. Russell and her office as we've defined and refined and further developed our return to school plan to make sure that our preparations are carried out using the most up-to-date scientific information. While our mandate continues, of course, to be providing students with quality, inclusive education, we know that students can't be positioned for long-term success if our educators and our learners don't feel safe. Alors, notre mandat, ça reste le même, de fournir aux élèves une éducation inclusive et de qualité. Cependant, pour favoriser leur réussite à long terme, il faut que nos éducatrices et éducateurs, tout comme nos élèves, se sentent d'abord en sécurité. Je l'ai dit au mois de juin dernier et je trouve pertinent de le répéter aujourd'hui. Cette mise à jour ne permettrait pas de répondre à toutes les questions que chaque personne pourrait avoir à propos de l'année scolaire de 2020-2021. So I said this in June, I've said it multiple times since, and I'll say it again today, that this address, this update is not going to address every single question that every parent, every student will have about the coming school year. But over the course of the coming weeks, I'm going to do my absolute best to answer every single question through those multiple opportunities. Because there are going to be other questions, and we're going to have other sessions to talk about how the classroom bubbles work, how reduced group sizes are going to work, what blended learning is going to look like for high school students, and our plans for integrating technology and personalized learning into the classroom. So again, coming weeks, I'll get to as many of your questions as I possibly can. Because there are many aspects to this plan. As I said, way too many to go through in one news conference. And we're going to continue throughout as well to work with public health to meet the needs of students and staff as the situation changes and new information is presented. So today, the purpose of today's briefing is to give an overview of the new details in the plan and to answer some questions around safety measures in schools. So let's get going. As of September, students of all ages will need to bring a clean face mask to school with them every day. Face masks are not going to be required inside the classroom while students are working if physical distancing can be maintained. À compter de septembre, les élèves de tous les âges devront apporter un masque en tissu propre chaque fois qu'ils se rendent à l'école. Le port du masque ne sera pas obligatoire dans les salles de classe lors des activités éducatives régulières si la distanciation physique recommandée par la santé publique peut être respectée. So while students in kindergarten and up to grade 5 will be encouraged to wear masks in common areas, such as when they're going to the washrooms or walking in the hallways, they are not going to be required to wear them. I've previously discussed that around the issues of younger students, the difficulties for them of putting the masks on, taking them off, touching their face, their noses, eyes, etc. So that said, we still want those students to have a mask with them. In the event that a student becomes ill at any point during the school day, as is the case with our early learning and childcare centers, they'll be required to wear the mask at that point until their parents or guardians arrive to take them home. And at that point, that situation passes over to public health, and Dr. Russell will address those details. Students in grades 6 to 12 are going to be required to wear face masks as they travel through common areas in schools. And based on our discussions with public health, teachers and educators from K to 8 will be able to choose if they'd like to wear a face mask or a shield with a mask within their classroom bubble, but they will not be required. Because as we've talked about over and over again as a province, and Dr. Russell has been incredibly effective in getting this message out, the best way to keep COVID-19 out of our schools is to keep COVID-19 out of our province. So this is how we can all help. In the high school setting, where students are not bubbled in classes so they can be allowed to have a more personalized learning experience, taking the optional classes that define the difference between high school and other ages, teachers will be required to physically distance from students. If they can't distance themselves for whatever reason, they'll be required to wear a mask. These same rules all apply to the use of public school buses. Ces mêmes règles s'appliquent aux élèves qui prennent l'autobus scolaire. Younger students who are not required to wear a mask will sit alone or with a member of their household. Older students will be able to sit two to a seat, but they will be required to wear a mask whenever they're sharing their seat, in addition to wearing them while embarking and disembarking. Clear curtains are going to be installed in the buses to provide a physical barrier with the bus driver when students get on and off of the bus. And if physical distancing is not possible, the bus driver will be required to wear a face mask or a shield with a mask. Students will sit in the same seat every day on the school bus to facilitate contact tracing if that ever becomes required. And to reduce congestion and to promote physical distancing, whenever possible, buses are going to be filled from the back to the front. And that way, students will not have to pass each other while getting on and off the bus. To keep our schools healthy and safe, guidelines around illness must be followed by staff and students throughout the year. If a student is ill, they must stay home. Teachers will be able to work with students on an individual basis to make sure they're able to make up any work that they have missed in class. But let me be clear about this. This is nothing new for our education system. We've got outstanding, motivated teachers who've been meeting the needs of our students for years, regardless of their individual circumstances. And I have every confidence that they have got the training and, of course, the passion to continue carrying out their exceptional work. Je tiens à préciser que ce n'est rien de nouveau pour notre système d'éducation. Nous pouvons compter sur des enseignants, des enseignantes remarquables et motivés qui donnent leur maximum pour répondre aux besoins des élèves depuis tellement d'années, et ce, peu importe les circonstances individuelles. Je suis persuadé que ces professionnels de l'enseignement ont la formation et l'enthousiasme qu'il faut pour continuer à effectuer le travail exceptionnel qu'ils accomplissent durant chaque année scolaire. Il faudra donc que les parents soient être vigilants pour surveiller la santé de leurs enfants. La Dr. Russell va aborder cet aspect dans quelques minutes. So what this means is that parents are going to have to be extra careful, extra vigilant, monitoring the health of their children, and Dr. Russell will get into the details around that momentarily. Preparing students for the future is what everyone in our education system does best, and our teachers are going to work with the students so they're prepared for life during the reality of this pandemic. Students are going to be taught age-appropriate ways to reduce physical contact and to promote hygiene. They will be taught how to wear their masks properly and reminded not to touch their faces. Families and staff can also anticipate several changes within schools. So depending on each school's operational plan, there may be arrows on the floor to direct traffic within the school, limits to the number of students or staff who can be in a given common area, such as a washroom or break area, and designated doors for entry and exit. Hand sanitizing dispensers will be placed at school entrances and in every classroom. Students are expected to sanitize their hands whenever they enter a school or classroom. Students must be prepared to bring a clean water bottle with them every day, as our drinking fountains are being replaced with water bottle filling stations. So departmental staff have spent a huge amount of time working with health and safety experts, with WorkSafe MB, to develop strenuous cleaning and disinfecting protocols. Le personnel du ministère a consacré beaucoup de temps à travailler avec les experts en santé et en sécurité de travail sécuritaire MB pour élaborer des protocoles rigoureux de nettoyage et de désinfection. Facility staff have even been developing training videos for custodians and bus drivers, so they're prepared to implement these new directives. We're making a few changes to cleaning schedules so that families can know what to expect. Those are going to include commonly touched areas, such as doorknobs, for example, will be cleaned regularly throughout the day. This is going to include cafeteria and eating areas, which are going to be cleaned between uses. Personal spaces, such as desks or lockers, will be cleaned daily, and change rooms cleaned a minimum of 3 times a day. We've got just under 300 schools across our province, and each with its own infrastructure, each with its own special culture. And so that means that there's no one-size-fits-all plan. So we'll have more details on specific school cleaning protocols. Those will be shared with each individual operational plan that each school is developing. Alors, nous avons près de 300 écoles dans la province, chacun avec une infrastructure et un milieu scolaire qui lui est propre. Cela veut dire qu'il n'y a pas un plan universel ou un plan uniforme qui convient à tous les établissements scolaires. D'autres détails concernant des protocoles précis de nettoyage dans les écoles seront présentés dans les plans opérationnels distincts. As I mentioned way back in June, there's also going to be a number of restrictions on who can enter into schools. Visitors are only going to be allowed entry if they have an appointment approved by the principal. So that means that parents can expect their communications with teachers to be more technology-based during this coming year than they have been in the past. I know that thought might not give families a lot of comfort as they think about the home learning options that were on offer between March and June of this year. But I've said it again, and I will repeat it again today, that what we experienced between March and June was not ideal. It was an emergency response to an emergency situation. And we've spent the intervening months making sure we're well prepared for dealing with COVID-19 with a much higher level of educational rigor as we move into this fall. But regardless of that, I want to take a moment to again thank the teachers who throughout that period did go above and beyond, who reached out to parents, to families, who embraced new technologies and new teaching methods. And that to me is what is going to make our system succeed through this pandemic, is the strength and the resilience and professionalism of our classroom teachers. So même si je l'ai déjà mentionné, je tiens à le redire, au printemps passé, ce n'était pas un système parfait en tout point, pas du tout. Malgré tout, je suis fier d'avoir entendu les témoignages à propos d'enseignantes et d'enseignants qui ont surpassé les attentes pour favoriser les apprentissages des élèves. Dans l'ensemble de la province, nos éducateurs ont travaillé fort. Ils ont adapté les nouvelles méthodes d'enseignement et ils ont ajouté des nouveaux outils pédagogiques à leur trousse éducative. Je leur suis grandement reconnaissant pour le travail remarquable qu'ils ont complété depuis le début de la pandémie. Et il faut certainement souligner leur dévouement pour favoriser le bien-être des élèves. I'm so grateful for the outstanding work and devotion so many of you have shown throughout the pandemic. And furthermore, the pandemic, of course, it's constantly evolving. And our plans have to evolve with it. We have to be flexible, adaptable, and ready to change when new information becomes available. Comme vous le savez, la situation de pandémie évolue sans cesse. Nos plans doivent donc être souples, adaptables et de surcroît, nous devons être prêts à les modifier au gré de l'évolution du contexte actuel ou lorsque de nouvelles données nous sont fournies. So Dr. Russell is going to elaborate a little bit more on what parents can expect from public health in the unfortunate event of our province experiencing another outbreak in the school or in a community. But in the event that students are sent home to isolate, whether that includes a single student, a class, or an entire school, full-time learning will continue to be mandatory. While certain learning objectives may be prioritized during an outbreak, students will follow their curricula. Students from kindergarten to grade 2 will be provided with paper-based materials and work packages to complete from home, and teachers will check in with them daily. That will be required. Similar packages will be reproduced for students in grade 3 to 5 and will be supplemented with some technology learning. Teachers will develop a teaching routine with students and stay up to date on their progress. Older students, so students from grade 6 to 12, will use technology-based distance learning full-time with their teachers throughout the school day. So for high school students, the blended learning model will support this approach as they follow a more personalized learning strategies, focusing on project-based learning that builds on their interests. This is a lot of information to explain in one shot. And that's again why I've made the commitment that I'll be back here at least twice a week to share more information on this and other topics and to get into as much depth as required. In the meantime, don't hesitate to reach out to the department. You can reach out to me individually at dominic.cardy@gmb.ca, and I'll do my best to get back to you. And I'll take that moment to apologize for any delay in responding to folks over the last month as I whacked my head in early July, and that caused me to required to take time off screens for a few weeks, which caused a backlog of emails. But I promise I'm working to catch up, and everyone will get a reply that I hope answers their questions. Je sais que ce sont beaucoup de renseignements à fournir et à digérer en une seule fois, et c'est pourquoi nous avons pris l'engagement de présenter une mise à jour 2 fois par semaine jusqu'au début de classe et ainsi aborder ces questions de manière plus approfondie. For our return to school plan to be successful, we need families, we need educators and school staff to feel safe, and we also have to have confidence in our plan. Si nous voulons réussir le retour à l'école en septembre, il est primordial que les familles, les éducateurs et le personnel des écoles se sentent en sécurité et aussi qu'ils ont confiance dans le plan que nous présentons. Au cours des prochaines semaines, je m'efforcerai de répondre à vos questions au mieux de mes connaissances afin de vous donner un portrait global du scénario prévu à la rentrée scolaire le 8 septembre. So, as I've said a number of times now, I will keep on coming back and keep on coming back and keep on answering questions because you deserve it. This is your school system. This is an incredibly anxiety-provoking time. There's a lot of reason to be asking questions. This is not a situation our system has faced before, and I'm going to do my very best to make sure that all of your questions are answered. So between the work that's being put in at the departmental level, with the school districts, with school administrations, and with our teachers, I'm confident that we can safely reopen schools in September. We've got a huge number of motivated and talented educators, our EAs, our teachers, our other support staff, our leads, who I know are going to be able to bridge any gaps in learning over the course of the coming year. So I'd like to take again a moment to thank all of those people in the system at every level for their collaboration, their patience, and their understanding. And despite the unfortunate circumstances the world finds itself in today, we've been able to do what New Brunswickers do best, to come together to overcome whatever obstacles thrown in front of us. Malgré les circonstances malheureuses avec lesquelles nous avons dû composer, nous avons de nouveau réussi à faire ce que les gens de Nouveau-Brunswick font le mieux, unir leurs efforts pour surmonter les obstacles qui surgissent, quels qu'ils soient. Merci de votre attention et j'invite maintenant le Dr. Russell à vous dire quelques mots. So thank you very much for listening to me today. I invite Dr. Russell to come and share a few words, and we'll be happy to take questions afterwards. Thank you so much. Merci beaucoup. Dr. Russell.
Thank you, Minister Cardy. Merci. Good afternoon, everyone. Bonjour. It will soon be September. It's the time of year when children, parents, and teachers prepare for the start of a new school year. But this September won't be like last September or any other school year that we have known. Ce sera très différent pour les familles, les enseignants et les personnels des établissements scolaires. Et c'est une expérience éprouvante pour tout le monde. Mais je suis convaincue que nous pouvons ouvrir les écoles du Nouveau-Brunswick en toute sécurité. Nous avons un plan pour répondre aux éclosions de COVID-19 à l'endroit et au moment où elles se produiront pendant l'année scolaire. Public Health has been working closely in the Department of Education and Early Childhood Development and school districts to ensure that schools can reopen safely and that parents and teachers can feel confident that the health and safety concerns are being addressed. Puis c'est pas différent que tout au long du pandémie, le travail que la santé publique a fait avec chaque entreprise, chaque différente association, fur et à mesure que les différentes parties de l'économie ont pouvoir être ouvertes. Alors, comment qu'on a fait tout ça en sécurité? C'était avec l'avis et la recherche et les informations qu'on a partagées avec la santé publique et l'Agence de santé publique du Canada. So this is no different than the type of work we've been doing all along with public health, from the Public Health Agency of Canada, with our counterparts across the country, sharing information and resources and direction with each type of business and each type of association as things have been able to open up within New Brunswick. And so this is no different. We have strong working relationships with the Department of Education at the provincial level and at the regional level, as we have in other areas and other concerns in the past. The Parent and Public Guide being released today is the result of the collaboration and is endorsed by Public Health. I want to be very clear that this is a plan for managing risks, not eliminating them. There will be further outbreaks of COVID-19 in our province, and it is possible that with some of these future outbreaks, there will impact one or more of our schools. And in fact, at the provincial level, we have been doing tabletop exercises to practice these scenarios. Alors, au niveau de la province, on fait des scénarios où on peut pratiquer les effets et les situations des éclosions dans une école ou plusieurs écoles en même temps. Je veux être très claire sur le fait qu'il s'agit d'un plan visant à gérer les risques et non à les éliminer. D'autres éclosions de COVID-19 auront lieu dans la province et il se peut que certaines de ces éclosions touchent un ou plusieurs établissements scolaires. Mais nous allons de l'avant car le coût du maintien de la fermeture indéfinie des écoles doit être comparé aux répercussions qu'une fermeture prolongée aurait sur les jeunes du Nouveau-Brunswick. We are moving forward because the cost of keeping our schools closed indefinitely must be weighed against the impact of a long-term closure would have on the young people of New Brunswick. Getting back to school is vital for our children. It is important that they continue to get a properly structured education. And this information and these conversations and discussions have been taking place with our public health colleagues across the country, the Chief Medical Officers of Health and Public Health Agency of Canada. So it's not something that is taken lightly, and all of this information has been shared with the Department of Education in the planning process, along with jurisdictional reviews, etc. Alors, les discussions sur l'importance de l'éducation pour nos enfants et nos jeunes sont discutées à le niveau national avec les médecins hygiénistes en chef de toutes les provinces et aussi avec l'Agence de santé publique du Canada. Alors, c'est très, très important et on est vraiment convaincus que les étapes, les processus qu'on mis en place maintenant sont ceux qui sont plus sécuritaires. Mais au fur et à mesure qu'on a d'autres informations, nous sommes préparés à changer nos avis basés sur l'information qui change puis les recherches qui changent. So with the sharing of information from Public Health Agency of Canada and whatever new data and research is available, we will continue to input that information with our colleagues in education. And if there are changes that we will need to make, we will make those changes as we move forward. C'est nécessaire pour leur santé mentale et leur développement social. Nous voulons tous que cela se déroule de la manière la plus sûre possible et c'est le but du plan que le ministre Cardy présente ici aujourd'hui. Nous avons tous un rôle à jouer pour assurer la réussite de ce plan. It is up to us as parents, teachers, to make sure that students are ready to deal with this new normal and understand what is happening in the world around them. Comme parent, je connais que c'est quelque chose qui cause de l'anxiété, qui cause des inquiétudes. Je suis parent, je suis maman, mes enfants seront à l'école avec vos enfants. Alors je comprends l'anxiété et les inquiétudes. So as a parent, I share your concerns, I share your anxieties. My children will be in school with your children, so I do understand what concerns you have at this time. And as Minister Cardy said, we will be here to answer questions as they come up. And again, we are very concerned that everything goes as planned and rolls out as well as possible, with as much information sharing as possible, so that everybody feels comfortable, knowing that it is very normal for this anxiety and it's very normal for these concerns to be at the forefront of your minds right now. It is particularly important that we reinforce the things that children can do to keep themselves healthy. They can limit their contact with other students by staying in their classroom bubble. They can wash their hands regularly and thoroughly several times a day. Alors, il y a des choses qu'on peut faire avec les enfants pour les éduquer, pour comment rester en sécurité. Et il est particulièrement important de renforcer ces mesures avec les enfants pour qu'ils puissent prendre de demeurer en bonne santé. Ils peuvent limiter leur contact avec les autres élèves en restant dans le bulle qu'ils forment avec leurs camarades de classe. Ils peuvent se laver les mains régulièrement et soigneusement, plusieurs fois par jour. When social distancing isn't possible, they can wear a mask to limit the spread of the virus. Est-ce que vous connaissez des gens qui ont besoin des masques? C'est le temps maintenant pour faire sûr qu'on a le support pour maintenir tous les processus qu'on veut mettre en place. Est-ce que vous avez quelqu'un qui peut rester à la maison si vous avez besoin d'isoler? Est-ce que vous avez des masques? Est-ce que vous êtes préparé? Est-ce que vous avez déjà eu des conversations avec votre employeur pour dire que, fur et à mesure que des situations vont se passer et dérouler, est-ce que vous êtes préparé? So, do you have the supports in place right now to be able to assist if your child has to stay home and self-isolate? Can you stay home with them? Have you had conversations with your employer about that? Do you need masks? Now is the time to get ready and prepare for that support that you will need as you go through the school year. Parents will be primarily responsible for monitoring their children's health and keeping them home when they aren't well. Teachers and staff have also been trained to watch for common symptoms of COVID-19. But even with all these precautions, the COVID-19 virus may find our way into our schools. And again, we're expecting this and we're preparing for this. And I think just as we've had fire drills, we've had lockdown drills, people understand what to expect when these things happen, and that's part of the preparation, is preparing people's expectations about what's going to happen in the event of an outbreak. Alors, comme on a fait des exercices pour les feux, des exercices pour quand il faut avoir des fermetures soudaines dans les écoles, on pratique les choses, on a des expectations, on peut prévenir qu'est-ce qu'on veut vouloir les processus qui soient en place pour pratiquer et avoir pour prévenir qu'est-ce qu'on va avoir de gérer. We all need to be prepared for that, and I want to explain what will happen when a positive case is discovered in a school setting. And I'm not saying if, I'm saying when, and that is what we're prepared for. When a positive case, and I don't mean somebody who is being tested, so I'm going to pause right now and repeat what I've just said. I'm not talking about when somebody is being tested. I'm talking about when a positive case has been diagnosed. Here in New Brunswick, our positivity rate is for every 1,000 people who get tested, who have symptoms, only one person is tested positive. So that means there are 999 people who get tested who are negative, and only 1 out of 1,000 tests positive. So if every time a person is tested, that means that 999 people would be worried and concerned, and if they shared that information with other people and they acted on it, for instance, in situations where businesses have been shut down and people have been sent home from work, that is quite disruptive. So we wouldn't want to see that in schools. So just remember the fact that it's a diagnosed case, not somebody who is being tested. So when a positive case is identified with a student or staff member, public health will advise the school, who will in turn communicate with parents in the school and the community. Public health will be responsible for contact tracing, and the classroom bubble will be helpful in determining who should be contacted. Some individuals may be required to self-isolate to limit the spread of the disease. This could be a few people, a classroom, multiple classrooms, or even an entire school, depending on the level of contact with the infected person, depending on how public health staff assess that risk. And I can tell you that my regional medical officers of health have been doing an amazing job up until this point with the teams in the regional, in the regions to make this happen with the outbreaks that we've already seen and the continuing cases that we have seen. A single case of COVID-19 will not automatically trigger a closure of a school. Si un élève ou un membre du personnel reçoit un diagnostic positif, la santé publique en informe l'école qui, à son tour, communique avec les parents et la communauté scolaire. Puis je vais poser là parce que je veux renforcer le message que c'est un cas positif diagnostiqué. Pas quand quelqu'un va être testé. Dans la province de Nouveau-Brunswick, pour chaque 1000 personnes qui sont testées avec des symptômes, seulement une personne teste positif. Ça veut dire que 999 personnes avec des symptômes qui sont testées pour le COVID-19 sont négatifs. Alors, ça veut dire qu'on ne peut pas fermer les écoles, les entreprises, etc., quand les gens sont testés. C'est seulement après que quelqu'un a été diagnostiqué qu'on va faire les contacts, avec les recherches avec les contacts étroits. Et dans ce cas, la santé publique, nos staffs vont contacter les gens qui sont à risque. Et c'est ça qu'il faut vraiment rester informé sur cette information parce que c'est ça qui soit le processus qui va arriver quand un cas est diagnostiqué. La santé publique est chargée de la recherche des contacts et la bulle que forment les élèves de la classe permettra de déterminer avec qui elle doit communiquer. Certaines personnes devront peut-être s'isoler pour limiter la propagation de la maladie. Il peut s'agir de plusieurs personnes, d'une ou de plusieurs salles de classe ou même d'une école entière, selon le type de contact qu'elles ont eu avec la personne infectée. Mais cela va être déterminé par l'équipe de santé publique. Outbreaks will be managed to limit disruption of the learning environment to the greatest extent possible. It may be difficult for parents because you may not receive all the information you might want in the event of an outbreak at your child's school. And again, as a parent, I can understand that type of frustration, but again, you have to trust in the process and trust in how our regional teams in public health are going to be managing these outbreaks. And again, the success that they've had in managing the outbreaks thus far. We have a requirement to protect the privacy of individual New Brunswickers, so only affected persons and families will be contacted. This is very important. C'est très important de protéger l'identité des gens qui sont infectés. On ne veut pas que les gens soient stigmatisés. We really don't want people to be stigmatized. We want everybody to feel comfortable that we are going to be living with COVID-19 for a very long time, and this is going to be part of the normal process of how we're going to be living with it. If you learn of an outbreak at your child's school, not hearing from public health is a good thing. Public health contacts those who need to be based on a risk assessment. Si vous apprenez qu'il y a une éclosion dans l'école de votre enfant, ne pas recevoir de communication de la santé publique est une chose positive. Nous nous engageons sur une voie jamais suivie auparavant alors que nous amorçons cette nouvelle année scolaire. We are embarking on an untraveled road as we begin this new school year. None of us has been through a September like this one. And the challenges ahead will require bravery, wisdom, compassion, and kindness from all of us. They will require active vigilance, active caring, so that our students stay healthy and safe. We can get through this by working together and supporting each other, and I can't underline that enough. We really need to support each other. Les défis qui nous attendons nous demanderont à tous à faire preuve de bravoure, de sagesse, de compassion et de bienveillance. Nous devrons être activement vigilants et attentifs afin d'assurer la santé et la sécurité de nos élèves. Nous y parviendrons en travaillant ensemble et en nous entraidant. Merci beaucoup. Thank you.
Merci, Monsieur le Ministre, et merci, Dr. Russell. We'll now proceed with questions from the media. Each reporter will have one question and one follow-up. You can pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aurait une question et un suivi. Vous pouvez poser vos questions dans la langue de votre choix. Vicki Hogarth, CHCO TV.
Thank you. My question is for Dr. Russell. Dr. Russell, will the return to school as well as the onset of colder weather mean that as a province we should increase the amount of overall testing New Brunswick is doing for fall and winter, or perhaps even adopt a more random testing strategy to prevent outbreaks?
Hi, Vicki. So our testing strategy right now is being worked on by our public health teams. And in terms of how it works with the schools opening and winter weather, there is no plan to change things at this time, but certainly the goal has always been to make sure that our testing reflects what we will need to know to be confident that there's no community transmission, et cetera.
Thank you, Dr. Russell. Vicki, do you have a follow-up?
I do. It's for Minister Cardy. Thank you. Minister Cardy, for rural high schools with smaller classes but inadequate community infrastructure, will the option be made available for those schools to continue daily in-person classes for all students, provided social distancing measures are met?
Hey, Vicki, thanks for the question. And yeah, the individual school plans I mentioned are going to be left up to those schools as long as they meet the parameters for physical distancing, for exactly the safety measures that you mentioned. So, there's obviously a big difference between a small rural school and a large urban one. There are some schools in the province which have been struggling with declining enrollment. Others where the playgrounds are filled with portable classrooms. So there's hugely different realities there. So yeah, we're letting the schools give us their plans we want to keep things as normal as we possibly can. Pour répondre brièvement en français, oui, absolument, c'est pour chaque école, ils ont un plan individualisé pour assurer que ça répond aux besoins de communauté scolaire dans chaque contexte, dans chaque communauté scolaire. Et pour les petites écoles secondaires, oui, absolument, il peut retourner presque au normal dans certains cas. Dans les grandes écoles urbaines, avec un grand nombre d'élèves, beaucoup de portables, c'est assez différent et pour eux, absolument, ils ont besoin d'adopter les nouvelles mesures. Mais si les écoles peuvent assurer la sécurité, la santé des élèves, pour nous, la manière qu'il arrive à ce point, ça c'est le but de notre système, d'avoir un niveau de choix encadré par les réglementations qui assurent la sécurité des élèves et aussi les équipes scolaires. Merci.
Thank you, Minister. Thank you, Vicki. Hadil Ibrahim with the CBC, your first question, please.
Thank you. This plan says parents are to monitor their children daily. Will schools be doing any health monitoring for students and teachers?
Sorry. Who is your question for?
Either, but I guess Minister Cardy?
So my understanding is that the parents are responsible for making sure that their children are well enough to go to school and don't have symptoms. But certainly if it's noticed by a teacher, then that would cause somebody to be contacted at home, obviously, which is the case today. If children are unwell at school, I'm sure teachers and principals are aware of that. And if a child is unwell, they do contact the parents.
Thank you, Dr. Russell. Hadil, do you have a follow-up?
Yes, I have a second question, but just to confirm, will there be monitoring for teachers?
I think it would be very important for all staff and teachers to be self-monitoring all the time, and we would not want anybody to be going to the school who is not well and has any kind of symptoms that could be related to COVID-19.
Thank you. And my second question is for Dr. Russell. Last week you announced physical distancing will be reduced from 2 meters to 1, provided that people wear a mask. In this plan, students are 1 meter apart but not wearing masks. How prudent do you think this is?
That's a great question, Hadil, and I think a lot of parents and staff would be asking the same question. So with public health being involved in all of the advice and all of the planning, we are confident that we can do this safely. Again, if people are staying at home when they don't have symptoms, if our numbers of total cases in the province are kept low, if everybody's if everybody, even outside the school system, is following public health directions, then I think we're balancing the risk of keeping kids home indefinitely during the pandemic and allowing them to have as normal educational experience as possible, knowing that the social development, the educational development, psychological well-being of kids is very, very important and very dependent on being able to attend school. But my understanding is that, again, this information contained in the guidance documents has all been endorsed by public health.
Thank you, Doctor. Thank you, Leah. Alexandre Boutreau, Acadie Nouvelle.
Oui, bonjour. Je me demande, qu'est-ce qui va se passer si plusieurs élèves se présentent à l'école sans masque? Est-ce que les écoles en auront en réserve en cas d'imprévu ou est-ce que les élèves en question seront renvoyés à la maison, par exemple? Qu'est-ce que vous avez prévu pour ces cas-là?
Et merci pour la question. C'est encore, on va voir les politiques sur ça pour assurer que c'est juste comme les autres questions de discipline dans les écoles. En commençant pour dire, OK, regarde, tu as oublié ton masque, oui, on a une, mais ce n'est pas le but de donner chaque jour à chaque élève un nouveau masque. Alors, c'est juste comme les autres réglementations pour la vie scolaire, pour les étudiants. Il y a l'expectation que, oui, il va porter les masques. Si c'est juste une question d'une journée qu'il oublie, on peut arranger quelque chose. Mais encore, ce n'est pas le but de donner tous les élèves un nouveau masque chaque jour qui est donné par l'école, parce que ça va clairement créer un niveau d'investissement qui n'est pas prévu. Et je veux investir l'argent dans tous les cas pour assurer l'augmentation de la sécurité de notre système, de santé des élèves et l'équipe scolaire. So just to answer that one again in English, around what happens if kids don't come to school with masks, that the goal is to be flexible. It's another rule in school. You're supposed to bring a mask. If you forget one day, we'll provide you with a mask. If you forget 2 days, you're going to start to get the raised eyebrows. The goal is to make sure that students obey the rules. Like everything else with school, there'll be challenges with that, but I'm sure that our teaching staff is up to it and will be there to give them the backup that they need. I hope that answers your question. Merci.
Merci, ministre. Alexandre, avez-vous un suivi?
Oui, j'ai une question sur un autre sujet. Au secondaire, comment est-ce que vous allez déterminer quels élèves pourront être en classe un jour donné et quels élèves devront être en classe le deuxième jour? J'imagine que ça pourrait devenir compliqué dans des écoles où il y a une population assez élevée. Comment est-ce que vous allez déterminer ça ou comment est-ce que les écoles vont le déterminer sur le terrain?
Once again, something that, je m'excuse, pour la question de comment est-ce qu'on va décider, c'est on adresse ça avec les plans individualisés de chaque école parce que, encore, les besoins de chaque école sont différents. Quand j'ai mentionné pour la première question, aujourd'hui, dans certaines écoles, il n'y a pas besoin de faire de grands changements parce qu'il n'y avait pas un grand nombre des élèves dans l'école. Pour les autres, c'est absolument nécessaire. Alors, on peut discuter ça en détail dans les semaines qui arrivent. Une chose que je veux dire, parce que je pense que c'est assez primordial, que l'expérience pour chaque famille va être une expérience. Alors, tes élèves vont aller sur l'autobus ou non, vont aller à l'école, une expérience dans les salles de classe. Oui, ça va être différent, mais pas tellement compliqué. Alors, toutes les différentes règles qu'on discute aujourd'hui, je demande à tout le monde de se souvenir que pour chaque famille, ce ne va être pas aussi compliqué que ça. Ça va être juste l'expérience pour chaque élève qui va être un peu différent que l'année passée, mais j'espère que ça peut être aussi simple que possible. Et ça, oui, ça va prendre une période d'ajustement, la première 1-2 semaines, mais j'espère qu'après ça, que oui, ça ne va être pas comme d'habitude, mais ça va devenir assez normal jusqu'à le temps qu'on peut avoir un vaccin et mettre fin à cette pandémie. Just in English on that, each school, how we're going to figure out how to deal with the blended learning for the high school students. It'll depend on the size of the school and the individualized plan from each high school. And we'll be talking about that in more detail in the coming days and weeks. But also just wanted to underline something important, that for each family and for each student, they're going to have one day at school. They're going to get on the bus or not get on the bus, depending. And I want to give a shout out to all the parents who volunteered to drive their kids to school this year. It's making a huge difference. Their kids will go to school, they'll go to classes, there'll be a new routine just like there is every year. Certainly going to be a little bit more different than usual, but in the end, after a couple of weeks, it's going to be the routine. And so I'm really aware of the level of anxiety that all of these new rules and plans and everything else can create, But I'd ask everyone to remember that for you, all that's really going to matter is what happens with you and your family and your children. And that's a lot simpler. And yes, it'll be a bit of adjustment, but I hope that after 1 or 2 weeks, we'll carry on with this and get used to this, that awful phrase, the new normal, until we can have a vaccine, get the population vaccinated, and put this pandemic behind us. Thanks.
Merci, Monsieur le ministre. Marco Castadar, Radio-Canada.
Oui, cette question est pour le ministre Cardy. Est-ce que vous remettez la charge de la surveillance du port du masque sur les enseignants? Est-ce que c'est eux qui vont devenir une nouvelle police, si on veut, sur le port du masque à l'école?
Merci pour la question. Je vais prendre un peu d'exception sur l'idée qu'ils sont des polices. Les enseignants sont responsables pour former nos jeunes. Et la formation, c'est clair que ça inclut les réglementations sur le comportement, sur les autres manières d'agir dans les écoles. Alors, les masques sont seulement quelque chose qui est ajouté à une longue liste que je pense que tout le monde qui a vécu le système scolaire, on peut tous souvenir les réglementations qui étaient là. Alors, c'est juste une autre pour ajouter aux listes. Je suis complètement confiant que notre équipe scolaire exceptionnelle est absolument prête pour prendre cette responsabilité parce qu'ils comprennent le fait que nous sommes dans une pandémie mondiale et que c'est sérieux. Et la seule manière d'assurer que notre population peut survivre cette pandémie dans une manière sécuritaire jusqu'en aujourd'hui est de prendre les mesures pour assurer notre santé. So when it comes to teachers being like the police for enforcing mask rules, I don't think that's really accurate. Teachers are there to teach. And in this case, part of what they're doing is, yes, protecting public safety by enforcing the mask rules that have been announced today, but also they're teaching kids how to care for themselves and for their fellow students and for the community around them. And that's how we've gotten to the place that we are right now in this pandemic, which is one of the best in the whole world. So let's keep that up. And our teachers are there to help the next generation get ready for how to deal with a pandemic. We never thought we'd need that lesson. Turned out we did. I've got no doubt our teachers are going to continue their exceptional work in preparing our students to deal with a changed future that, sure, we couldn't have imagined it, but our teachers are up to the task. Thanks.
Merci, Monsieur le ministre. Marco, avez-vous un suivi?
Oui, merci. Ce sera toujours pour le ministre Cardy. Est-ce que le ministère va donner des ressources additionnelles, des ressources supplémentaires en termes de personnel ou de budget aux écoles et aux districts pour se préparer avec toutes les nouvelles normes là, qui doivent mettre en place d'ici la rentrée scolaire?
Absolument. C'est impossible de répondre à une pandémie comme le COVID-19 sans avoir les ressources additionnelles. Alors, on a embauché les nouvelles employés pour le système en grand, plus ou moins 150 membres de la Fédération des enseignants-enseignantes, plus ou moins 70 conducteurs d'autobus, et on a ajouté à peu près 10% au nombre des gens qui nettoient les écoles. Alors, juste sur la question des ressources humaines, c'est clair qu'il y a un grand investissement. Quand j'ai mentionné dans mon discours, on remplace les fontaines d'eau avec les stations pour le remplissage des bouteilles. On ajoute les stations de nettoyage pour chaque classe, dans chaque école. Alors, c'est une dépense d'à peu près 75 millions de dollars en addition du budget normal du système, le budget prévu pour répondre aux besoins créés par le COVID-19. So absolutely, we are making additional investments because you can't respond to something like COVID-19 without spending money. So we've hired around 150 new members of the Teachers Federation, both English and French sectors. We've got about plus or minus 70 new bus drivers, and we're adding about 10% to our custodial staff. We're replacing water fountains in every school with water filling stations. And we're making sure that every single classroom in every single school has access to a cleaning station. So we're making the investments that are needed to keep our kids safe, to keep our teachers safe, and all the professionals who work in our schools. Thanks for the question.
Merci, Monsieur le ministre. Merci, Marco.
Merci.
Adam Harris, Telegraph Journal, your first question, please.
Thank you. I'd like to hear from Minister Cardy and Dr. Russell on this one. School policies on masks differ widely across the country. I just wanted to know how you landed on what you did, and if there was a model of a policy from another province that you followed, and then for Dr. Russell, just to talk about why it is different in every province.
That's,
Oh.
sorry? Do you want to go first? Yeah.
Hi, Adam. So the discussion around masks at the national level have been ongoing since the very beginning of this pandemic. And in the information that we receive in terms of the research and evidence and studies continues to evolve. And so those discussions continue to happen as recently as this week. So we meet twice a week with the Public Health Agency of Canada, as well as the Chief Medical Officers of Health from the country. We have shared across all jurisdictions what the masking policies are in each school. And at the end of the last discussion on Tuesday was, we need to discuss it again. So wherever we land right now, it could change. So we're just going to deal with the information that we have today, knowing that more information is coming and will continue to evolve. So if you look at the different jurisdictions and what people are doing, it's a little bit all over the map, and it's because, again, the information that we get from Public Health Agency of Canada and all the studies that we're looking at in great detail continues to evolve. So I think parents and staff have to be flexible right now in terms of we're gonna make decisions based on what we know today, and as things change and evolve, then we're gonna make new decisions as needed.
Yeah, Adam. The only thing I'd add to what Dr. Russell said is that, from the very beginning of this pandemic, my approach has been to look at what's happening around the world and to take an approach that balances, as Dr. Russell has put it in every one of her statements, the educational needs of our students and the need to protect them and make sure that they're safe. And of course, by extension, the safety of the professionals who work in the school system as well. And so far, I think we've managed to achieve that balance. And with the help and guidance of Dr. Russell in public health, we've been out in front on a number of different files since the beginning of this pandemic, and it's one of the reasons that New Brunswick is doing well. So we're going to continue to follow that approach because it's working, but to do that, we continue to need the help of New Brunswickers. Because I've said a couple of times already, and Dr. Russell has said, we're going to say it in probably every one of these briefings, the way to keep our schools safe is to keep New Brunswick safe. And if we can keep COVID-19 out of this province and prevent community transmission as much as possible, that's the best way to keep our schools open and safe. We will have setbacks, we will have more cases, we will probably have cases in schools. But the more that we can follow the rules that are becoming familiar to all of us with social distancing, the use of masks when appropriate, that's the best way that we can keep our province safe and our kids safe. Alors, juste pour ajouter brièvement ce que Dr. Russell a dit, on a besoin d'être conscient que la manière plus efficace de protéger la sécurité de notre province, du système scolaire de notre province, et de protéger notre province, d'assurer la distanciation sociale, d'utiliser les masques quand c'est approprié et de prendre les avis des experts mondiaux. Jusqu'à ce point, c'est ça qui a vraiment nous aidé à arriver à un point positif dans cette pandémie. On va continuer dans la même direction. Merci.
Thank you, Minister. Thank you, Dr. Russell. Thank you, Adam. Mia Urquhart, CBC.
Could I get a follow-up, please? Sorry.
Yeah, a quick one.
Yeah, Dr. Russell, you addressed how all parents of a school won't be contacted if there is a COVID case found. To drill that down a little bit, would the parents of everyone in a class be contacted, or could it just be the one student's pulled and then that's it, no one hears the rest about it?
So Adam, I can't break down what's going to happen in each individual situation because each individual situation will be addressed by the public health regional teams. And so who is contacted will be determined by what the public health regional teams determine in terms of the risk. So if there's a risk that a child is a close contact, they will be contacted. And if there's a risk that they're not as close of a contact, they may be contacted not for self-isolation and or testing, but they may be contacted to say they need to self-monitor. And that's been the case throughout the pandemic. The process will not change just because it's happening in a school. The process has been in place since the beginning of the pandemic that when somebody's diagnosed, the close contacts are contacted, and if somebody is considered to be a lower risk contact with respect to not having as close contact, they would be told to self-monitor, and those people would be told either individually or they'd be told at the classroom or school level. And that's been the same case in terms of businesses that have been affected. If an individual tested positive, the close contacts were contacted and told to self-isolate, and then anybody who might be a contact that was less of a risk, then those people would be told to self-monitor.
Thank you, Doctor. Thank you, Adam. Mia Urquhart, CBC. First question.
Thank you. My question is for Mr. Cardy. The plan says high schools that can maintain physical distancing at all times won't have to have alternating attendance. So how many of those high schools exist in the province, and have those parents been notified that their kids will be going every day?
Hey, Mia, thanks for the question. Not yet. Again, that's down to the individual school level. We'll have a lot more details on that and how this high school system is going to work over the next week or so. So that's all the information that'll be coming out in the next little while. So juste pour les écoles secondaires, pour les écoles qui ne vont pas avoir les différentes manières de former les élèves pour une journée à l'école et une journée dans les autres endroits, on va avoir cette information pour partager dans les journées qui arrivent.
Thank you, Minister. Mia, do you have a quick follow-up?
I do, thank you. What if a parent is an essential worker, say a truck driver, who travels to other parts of Canada and must self-isolate when he or she comes home? What if they have school-aged children and self-isolate in the home? Do the kids have to as well, or can they go to school?
So our advice about self-isolation and essential workers and what's been in place right now for daycares would be very similar in the sense that obviously the risk, I'm going to break this down in a couple of ways. One, an essential worker who is work isolating, they are only required to self-isolate if they are directed to, with respect to if they are diagnosed as a case, because right now we are allowing essential workers to work isolate, but not necessarily self-isolate at home. Would it be prudent for family members of people who travel in and out of the province on a regular basis to self-isolate? That would be prudent. And especially knowing that we're going into a period of time where we can't predict what's going to happen with respect to the school setting and the risk of outbreaks. We are planning for all of those things, but we can't predict exactly how it's going to look and feel. What we do know, and this may reassure some people, based on the evidence and research as of today, which can change and can evolve, what we're seeing is the pattern of transmission from child to child is very low. So the likelihood of a child getting infected from another child is low. It's not zero, but the higher risk is for a child to get infected from an adult. So I think what we could expect to see is either children being infected in a household environment or close contacts of the household, or in that kind of a setting and bringing it to school, or an adult bringing it to school. So I think we just need to remember that the risk will never be zero. Whatever precautions we can take, we should be taking all the time. And so, you know, I think the idea of gatherings being a high-risk setting for transmission, when school gets back up and running, I think we have to make very, very conscious choices and decisions about what each household member is doing. I think at the school level, there's probably no more things that we can put in place than we have right now in terms of protecting the school population, the staff, students, et cetera. We have those things very clearly delineated. But what we really will need continued support and continued help with from each individual in this province is what you do as individuals in your household and who you interact with outside your household moving forward, because I think that is what's going to be critical with respect to success during the school year.
Thank you, Mia. Travis Fortnum, Global.
Hi there. My first question is for Minister Cardy. We touched on some of the extra investments being made for the school year, such as custodial staff and bottle filling stations. I'm wondering if we know if those will be in place for the start of the school year, or if it'll be an ongoing rollout.
The expectation is that we'll have those measures in place for the system in September when schools restart. So that's the goal. And if there's any updates on that, I'll let you know, but that's the intention. Alors, l'intention d'avoir les mesures de sécurité pour assurer la santé des élèves en place pour le commencement de l'école. S'il y a les changements, les exceptions, je vais les partager dans les semaines qui arrivent.
Thank you, Minister. Travis, do you have a follow-up?
I do, and probably Minister Cardy would be best to respond to this as well. I know it's hard to deal in absolutes, especially in a situation like this, but something stated in the plan and something you touched on a little earlier is that in the event of even in the event of an outbreak, learning will continue. Is that the case even if the province as a whole sees a wave to the degree of what we saw earlier this year, or even worse, perhaps?
Like you said, it's hard to deal in hypotheticals, but our intention is to keep the school systems open as long as Dr. Russell lets us. L'intention est d'assurer que le système scolaire reste ouvert jusqu'à le point que Dr. Russell dit que ce n'est pas sécuritaire de le faire. On a besoin de continuer l'éducation de nos jeunes, c'est primordial. We've got to keep educating our kids. We cannot let years and years go by. Otherwise, we'll be creating a lost generation, and I don't think any of us want that.
Thank you, Minister. Thank you, Travis. Charles Caméra, TVA, votre question, s'il vous plaît?
Oui, ma question s'adresse au ministre Cardy. Vous ne l'avez pas mentionné en conférence de presse. Peut-être que vous allez en parler là, dans les autres conférences de presse, mais je me demandais tout simplement concernant le programme d'aide là, pour les parents à moyens revenus et faibles revenus concernant les ordinateurs et portables. Est-ce que l'équipement va être remis à temps là, d'ici avant le début de l'année scolaire, tout simplement, pour ce qui est des portables et ordinateurs?
C'est quelque chose qu'on va adresser dans les autres conférences de presse, mais je veux juste dire pour commencer, pour les gens de faibles revenus, le programme donne les subventions pour les familles qui ont un salaire de juste à 85 000 $ par an. Alors, ce n'est pas exactement faible revenu, mais on va avoir les détails à partager dans les semaines qui arrivent. On the question of the subsidies for computers, for high school students in particular, that we will be handling all the detailed questions around that in the briefings that are going to be coming up over the next couple of weeks. It's a program that applies to all families who earn less than $85,000 combined income. We do take into account as well adjustments caused by COVID. If you had a full-time job last year and lost it because of COVID-19, we're going to base the assessment for subsidies on your new salary, not the pre-existing one.
Merci, Monsieur le ministre. Merci, Charles. Avez-vous une suivi?
Oui. Ma question peut s'adresser à Dr. Russell ou encore au ministre Cardy. C'est concernant l'amélioration des protocoles de nettoyage ou encore ce qui est de la sécurité du personnel et des dépistages. Est-ce que ça va être sensiblement la même chose partout dans les écoles et districts scolaires ou ça peut varier là, des différents districts scolaires, là, un peu comme le plan opérationnel? Est-ce que ça peut varier également?
Non, les standards sont imposés au niveau central. Les mesures d'assurer qu'il réussit d'achever les standards qu'on a soulignés au niveau central, ça c'est pour les écoles, avec le soutien des districts. In terms of the cleaning standards, we're setting the standards provincially. It's up to each school to figure out how to meet those standards, but they are those central standards, and they will be enforced. And that is absolutely, we have to make sure that everyone is equally protected when it comes to health and safety. And I know we're going to be wrapping up soon. I want to just take one moment and thank the folks who have been doing our translation and sign language work, because I know that I speak far, far too fast. I've been trying my best to be a bit more reasonable today. I just want to thank you very much for the work for the folks behind the scenes who have to go through a lot of stress from the folks of us behind this podium from time to time. So thank you to them.
Merci, Monsieur le ministre. Merci, Charles.
Merci.
That concludes today's update. Thank you. Voilà la fin de notre mise à jour. Merci.